My name is Nat Loudon. It's my pleasure to welcome you to the to the 401 on how to connect. With us today, we have Roger Hensley, David Bolt, and Sabrina Lee. And I'm going to get us started with an intro video.
Hi, I'm Rebecca Arnett, the project manager for the Kentucky Health Information Exchange. Although Hi, I'm Rebecca Arnett, the project manager for the Kentucky Health Information Exchange. Although I'm fairly new to the team, I've been involved in promoting the healthcare of Kentucky for over 7.5 years. I hope you're enjoying the conference. It is my pleasure to introduce you to the following session, the 411 on connecting from COVID to care. Connect with Andrew Bledsoe, State HIT Coordinator and Deputy Executive Director of the Office of Health and Analytics, and Sabrina Lee, Project Manager, as they dive into the ramifications of KI's Patient Alert Query Service, delivering queried results for COVID-19, neonatal abstinence syndrome, and the Office for Children with Special Healthcare Needs. Also, learn how Roger Hensley, Assistant Chief Information Officer, External Development, UK Healthcare Information Technology, and David Bolt, Executive Director, Kentucky Primary Care Association, have worked in tandem with KHI to deliver important event notification capabilities designed to close care gaps for their clinicians.
Good afternoon. In this portion of the eHealth Summit, we will be discussing capabilities and features of KHI's event notifications and patient alert query services. In this video, we will provide an overview of KHI's event notification and patient alert query functionality, explain how KHI uses event notifications and patient alert queries, and describe how these features benefit healthcare providers across the Commonwealth of Kentucky. So what are clinical event notifications? KHI's event notification services inform providers about particular healthcare activities or events that have occurred for a specific patient in their care. Event notifications track specific medical encounters for a patient and range from hospital admissions and discharges to toxicology results being made available, or indicate whether a specific patient has been overutilizing the emergency room. KHI's growing list of event notifications includes hospital admission, discharge and readmission, emergency admission, discharge, and emergency visit overutilization, specialty visit, behavioral health admission, and behavioral health discharge, results ready for review, toxicology screen received, and possible COVID-19 positive. So why do we need event notifications? KHI's event notification services enable healthcare providers to access valuable health information when and where it is needed, by monitoring for specific events and specific patients so providers are always in the know, and improving care coordination with timely updates about patients as they transition from various healthcare settings. So how does KHI use event notifications? KHI uses a variety of connection and transmission methods for event notifications. KHI can deliver event notifications to the provider's EMR system through FHIR APIs. The event notifications are generated in accordance with the FHIR standard and pushed to the participant's EMR interface in real time. Participants can then view these event notifications right within their EMR system. KHI can also deliver event notifications through a secure file transfer protocol. This secure file can be delivered directly into the participant's EMR system. KHI offers the capability to deliver event notifications into a provider's direct secure email. KHI leverages the widely adopted XDR standard to securely deliver the event notifications to a provider's direct secure account. Finally, KHI's ePartner Viewer provides the capability for providers to review and manage event notifications in a quick and easy-to-use interface. KHI's ePartner Viewer provides a quick and easy way for providers to start utilizing KHI's event notification services. Once users log in to the ePartner Viewer, they click Event Notifications and the blue ribbon at the top of the screen to review the list of event notifications for their panel of patients. From here, users can review recent notifications, where users see the most recent notifications that have been triggered for their patients. Deleted notifications, where previously deleted event notifications can be referenced. And managed notifications, where users can control which event notifications they would like to see for their patients, and where admins can control the event notifications for their organization. Finally, KHI has been continuously updating the list of event notifications, and that includes creating a new event notification specifically for COVID-19. This event notification quickly identifies a patient that is possibly COVID-19 positive and helps providers appropriately treat that patient. In addition to event notifications, KHI's Patient Alert Query services help providers stay informed about high visibility conditions. What is the Patient Alert Query service? KHI's Patient Alert Query service retrieves the latest information about a patient when they are searched and flags specific conditions that are high impact. This helps inform providers about specific healthcare events that have occurred for patients in their care. Currently, KHI offers the Patient Alert Query service for 2 conditions, and these are the Extreme Drug-Resistant Organism Alert and the COVID-19 Positive Alert. Patient alerts can be accessed through 2 methods. The first method is through a web service connection. This web service connection allows the participants to query KHI for the available alerts on a patient. If there is a patient alert available, then the query service retrieves the patient alert and delivers it to the participant's own EMR/EHR system. The second method to review patient alerts is by searching a patient using the ePartner Viewer. To see the Patient Alert Query service in action, users must simply use the ePartner Viewer and search for a patient. Patient Alert Query service displays a red banner at the top of the patient chart, alerting users that the patient is either XDRO or COVID-19 positive. This allows providers to quickly see the status of a patient, make more informed healthcare decisions, and improve care coordination. KHI's event notification and patient alert query services keep providers updated about specific healthcare events for patients and their care, reduce duplicative and redundant services, alleviate administrative burdens and costs, and improve care coordination with real-time patient information. This has been a presentation of KHI's event notifications and patient alert queries. Thank you for watching.
Good afternoon, everyone. I'm Sabrina Lee. I'm the project manager with KHI. I've had the pleasure of overseeing our new implementation for the past few years. I'm here today to talk about event notifications. Going to also talk with a couple of our technology partners who will help you to understand how they are utilizing the KHI data. I want to talk a little bit about what you saw on the video. We do have 3 types of event notifications. We have our Patient Alert Query service. As the video said, that's as if you were sitting there and the patient presents. At that time, when you query that patient, a back-end process will go back and you can ask KHI, what do you know about this patient at this time? And again, you can get things like today, COVID positive, you can get XDRO positive, and in the very near future, we will have the ability to get the NAS patients, the neonatal abstinence syndrome alert as well. So we're excited about all that we have and the various ways in which you can get information back. We heard you loud and clear. We knew that event notifications were important, alerts were important. So we hope we've pieced together a solution that is going to be valuable for all of you in your patient care endeavors. The next one I'll talk about is the event notification service. This is where you actually provide a patient panel to KHI. Various different ways. We'll get into that in a little bit more detail as they said in the video, but that's when you provide your own patient panel. You tell us who you want to know when an event happens on. When that event triggers for that patient, we send you back a notification in whatever way you choose to receive that. Lastly, but not leastly, is the CMS interoperability event notification. This particular event notification is going to help our hospitals fulfill the CMS interoperability rule requirements. So through an event notification, we will be able to help fulfill that requirement. Okay, now you can go to the next slide. Okay, I'd like to talk a couple of minutes about our partnership with KPCA. We have worked tirelessly to build a bi-directional connection. We've been working with David Bolton team on developing that connection. You see the pictorial here. David will be on in a little bit to kind of talk a little bit more about that. We've been able to, over the years, form a really strong partnership and collaboration with KPCA. KPCA was actually the first organization in which KHI sent event notifications out to. David and team were very integral in helping us flesh out the details and build the event notification service. So we're very excited about that partnership. In a minute here, I'm going to turn it over to David and have him talk a little bit about how David and team, the KPCA group, uses KHI's data. I know you saw in the intro, David serves as the CEO for the Kentucky Primary Care Association. David's got over 50 years of healthcare leadership, and we're extremely excited to have the partnership and collaboration with KPCA. David, with no further ado, I'm going to hand it over to you.
Thank you, Sabrina. And
real quickly, Dave, before you start, I just want to second the sentiments that Sabrina said. More than just helping build the bidirectional connection, the KPCA provided us a lot of technology resources and support during our implementation. And they were able to help us do several proof of concepts and help us to kind of pilot several new initiatives. And so without their partnership and support, our implementation would not have been as successful. So just wanted to throw that in there and build on Sabrina, Dave, and say thank you to you and your team.
And
no.
We didn't charge you a dime.
Exactly
okay.
Right.
Well, thank you very much. It struck me as I was writing down some notes that KHIE's come a long way from the original planning meeting in Frankfurt at the Catholic Church, by way of fact. And the first annual meeting in Louisville a few years later was in a fairly small room. It's, I think, grown well beyond our expectations, and the probability of it being a cornerstone of our future in surviving and working in a value-based payment system is absolute. For those of you that don't know, KPCA is an association of federally qualified health centers and independent rural health clinics. It's been around since 1976. Today we have over 170 clinics that are full or organizational members. KPCA is operated an independent practice association which contracts with MCOs and other payers since 2011. Today that IPA consists of 91 clinics with over 275 clinical sites and over 300 school-based clinics. They manage the care of over 750,000 Kentuckians, and these clinics are the safety net primary care system for Kentucky. 2 years ago, the board of directors planted a seed in the organization's strategic plan to create a centralized value-based data system. A picture of it is on the screen. After finding an agnostic consulting team, meaning they weren't attached to any particular vendor, and that group is Insight Med, actually based in Louisville. Months of meetings and plannings, discussions, and guidance from a core group of clinics, what emerged was what we call Charlie. And we call it Charlie because everyone got tired of saying centralized value-based data system. We issued an RFP and designed and directed by the clinics. Of course, with the expertise of our IT consultants, the clinics selected a vendor Healthware Systems based in Elgin, Illinois. An item to note is involvement of the clinics driving the entire process. I want you to hold that in mind. From there, we began the connection, the delicate work that we had to put into place for a proof of concept with 5 clinics and 4 different EMRs. Totally, we deal with 17 different EMRs throughout our memberships EMR systems. While the pandemic has slowed us down some, today we have 30 clinics connected and 15 more with paperwork signed and in the queue for onboarding. We expect to have 75% participation by the end of the first quarter of 2021, pandemic willing. What has evolved, as you can see, is an aggregator approach, merging real-time clinical data, figuratively real-time payer data, which we get from the payers, connectivity to KHIE and major reference labs. All of this data is housed in a high-trust certified environment with secure VPNs connecting sources of information. We have used two national HIPAA attorneys in a very laborious process to assure compliance and security, all targeted to provide a one-up and one-down connectivity to KHIE for the clinics. And the association pays for all the connections and costs for the EMRs to make that connection happen. So why did we do this? Well, we have already accomplished 2 major steps. Clinics now have access to the real-time ADT and other information that KHI can provide. And you can imagine, instead of waiting 2 to 3 months for notification that a patient has been discharged, now we can get that automatically. And we have absolutely found that has an impact on inappropriate use of healthcare resources, which of course drives cost and hopefully produces better outcomes in quality. We've proven that we can, through the use of AI, close care gaps. And what I can officially say now is we are one of 3 organizations selected by NCQA for certification review of our Charlie feed to payers. This will enable movement of data for use in quality reporting and for other business tools along the way. Our testing so far has been very positive, and even if we have NCQA restrictions, we will learn, we will adapt, and we will improve the system for the benefit not just of the clinics or the payers, but also for the patients we serve. We have several add-ons in process, including AI feedback on clinics for coding. We have a training component for clinicians to better understand their role and the importance of coding directly and being directly involved in value-based care. We have other programs to be introduced, including social determinants of health, risk scoring module, and more. So what are some of the other benefits, you might ask? First of all, you need to understand how we look at these types of projects. We create a win-win-win situation, a win for the clinics, a win for our partners, the payers, and DMS, and a win for the patients we serve. In other words, we must prove value. For the clinics, some of these things are automation of some of the labor-intensive tasks, real-time data to act on cleaner claims, and reduction of labor-intensive paper chases. Our proof of concept clinic for care gap closures calculated savings of over $400 for 98 claims, including closing care gaps. For the payers, it will allow clinics to focus on patient engagement and care, improve coding, produce better claims, and better quality data. For DMS, it will drive better data, risk scoring, and shore up actuarial data, provide better reporting to CMS, and the ability to measure the quality improvements for the covered lives by our Medicaid program in Kentucky. We have very much appreciated the partnership, the essential partnership with KHIE in this journey. And frankly, the MCOs and commercial products we work with have been very supportive also. Reference labs have connected directly to Charlie because we have asked them to, and most of the EMRs have been very helpful, and several have formally recognized us as development partners, as does KHIE. So the question might be, where do we go from here? Well, let me give you some guides about how we might will evolve. Several products we have in process now are data flows back to the clinics, and these are data flows and analytics that the clinics themselves have decided are important. And that in and of itself will be a teaching tool and a way that we will look at improving not just the quality of care, but reducing the cost of care also. There's probably much more we could talk about, but Andrew, I think, wanted to limit me to about 7 minutes, and I think I'm within that realm. So I'll turn it back over to Sabrina.
Sabrina, you're on mute.
Thank you, David. Great information. I've already gotten a chat message to see if we could share the slides for this session. So thank you so much, David. I think now we have, before we get into our next speaker, if you have any questions, go ahead and put them in chat. I know this has been the routine for most of the day. There also, after this, if we don't get to all the questions, we'll have a specific networking session for event notification. So you'll want to join that at 3:30 in the networking lounge if we don't get to your questions. So with that being said, next we'll hear from Roger Hensley. He's the Assistant CIO at the University Healthcare and UK Healthcare, and he leads the interoperability efforts for UK. Roger?
Thank you. I think the first thing I should say is I'm going to have to go back to UK, and we've kind of been bragging internally that we thought we were the first partner to use the notification service, but I do believe I heard Andrew call out David as the first partner to do so. And so we had to have been number 2. If
you all were neck and neck. You were neck and neck.
So,
it was neck and neck. You got it.
No, so this has been a very important initiative for us. When this came forward, we at the university, met with our chief medical information officer, Dr. Phil Bernard, and we identified the patient population that we were concerned about to utilize going forward with the event notifications that have been discussed in this meeting. And Dr. Bernard helped us identify those patients. We shared that with KHI, and then we moved forward with how we were going to use these in-house. Now we currently receive these notifications via the Web Services FHIR API. And it's very exciting for us because it's new technology. And what we do with that information is we convert it with our middleware or integration engine layer. And then we put that in the patient banner in the EMR that our clinicians use. And the reason we've done that is, in working with Dr. Bernard and others at UK, what we identified was not everyone always goes to identify if, Roger Hensley has had health, had health care somewhere else. And so there could be information out there that if they forget to look, wouldn't see. If we put this notification in the patient's banner, it basically alerts our clinicians that there is relevant information that needs to be reviewed for, optimal patient care. And so it was a very prioritized initiative for us. We were certainly more than happy to work with KHI to get this going for our facility and for our clinicians. And I think it's had a very positive impact on the use of this data within our institution. We've also successfully tested the query functionality with KHI in our test environments. And we hope in the future that we move into that space as well, because there's always the occurrence of a new patient coming to us that we're not necessarily receiving notifications on, that we still want to get information, or we would still like to be alerted if Roger Hensley was treated someplace else. And so we also have a very big initiative going on at UK Healthcare with the new EMR implementation. So that's kind of slowed us down a little bit with pursuing our successfully tested query mechanism. However, we do plan on picking that up as soon as possible and progressing with that activity as well. We've really, I would attest that we have worked very hard the past 3 or 4 years to partner with KHI and to really leverage the data set that KHI has to really increase our overall patient care.
Thank you, Roger. I just want to build on that as well, and thank you too. UK has been an incredible partner. We've been able. It's interesting because we share a common platform of sorts with the Deloitte platform. So there's a lot of ways we're able to do some additional interesting use cases, and you all are always willing. Anytime I give you a call to step up and help us, and we've done a lot of the hospital services on your side. So I appreciate your partnership and support as well.
Thank you.
KHI could not do what we do without both of these organizations who are here with us today. And we have certainly would not be as successful during this transition without them both. So I appreciate all of you. Okay. With that, actually, sorry, Sabrina, go ahead.
That's okay. Go ahead. I was just going to see if we had any questions in the chat. Is there anything else we need to address before we go there? Do we have time for that?
Actually, we are at the minute mark, so we're going to have to wrap this up.
Okay.
Unless there are any closing thoughts from either Dave or Roger.
I just want to know who Roger's going to tell at UK that we were #1.
I'm going to do so. Unfortunately, I'll have to tell my boss that.
Thank you. Thank you,
Roger. You are the first with the patient alert query.
Hey, there we go.
All right, there you go.
So.
All right.
Okay, thank you everyone for attending this session. We're going to close this out, and please head into the next one. We're going to be doing the ePartner viewer and talking about, have a couple of additional speakers who are going to be demonstrating some of their use cases that they use the ePartner viewer for. So please make your way into that session, and shortly we'll be wrapping up the day. Thank you all.